There is a mandate in the House version of the bill, and I actually think this is one of the broadest areas of support, bipartisan support, that exists, in that an individual can't be denied and their rates can't be arbitrarily adjusted for pre-existing conditions. That is the case in the House version of the bill.
I don't have much to add. That's the same in the Senate bill, is that you can't charge higher for pre-existing conditions. You can't exclude people for pre-existing conditions. You can't stop coverage because of a pre-existing condition.
But it's important to understand that that is the highest cost part of the pool that's out there with regard to the uninsured. And so if you're going to cover those individuals, which I think most people believe, people shouldn't be denied coverage because of pre-existing conditions. I don't run into a lot of people that think they should be denied coverage. It does increase costs. And so you have to then deal with that and the additional cost increase to the system, either to the private insurers or through the public option. So understand that there's a cost associated with that. And we can get into talking about some of the costs of the pay for us and some of the challenges on that side. But I think it's an important provision. I think most people believe that if you have an existing condition, you should be able to get affordable coverage.
Later on, though, if you could follow up, no unwarranted increase. If you have cancer, serious cancer, a warranted increase may very well be more than anybody can afford. So the idea of insurance is to protect you, whatever kind of insurance, even when you have a hugely expensive problem. And that's something we can address later. Sarah, do you want to go ahead and ask the first question?
Does this work?
My question has to do with rationing. Many Americans, and particularly seniors, are afraid that healthcare reform proposals, if enacted, would lead to rationing. I'm sorry. Many Americans, particularly seniors, are afraid that if the proposals are enacted, it would lead to rationing of healthcare services. These include reducing Medicare reimbursements to insurance companies and doctors, and recommending some medical procedures over others as more cost effective. How do you answer that concern?
Well, I would answer it by saying there's rationing in the system right now. If you don't believe there's rationing, I would encourage you to spend some time with some doctors. I hear on a regular basis from physicians the challenges they face with private insurers in terms of being able to get covered procedures that they prescribe. So rationing exists. What we want to move forward toward is better evidence-based medicine. And I would point to you, if you need a model for this, in Children's Hospital. Evidence-based medicine makes a lot of sense. And some physicians are reluctant, some healthcare providers are reluctant to move toward evidence-based medicine. Actually, the private insurers have been pretty good about accepting evidence-based medicine. And the idea behind evidence-based medicine is that, despite the practices of a lot of physicians, they think they know best as to what to do over the years. There is a pool, there is a body of evidence in many cases in dealing with certain types of illnesses and dealing with certain types of infections. And Children's laid out a whole host of things that they worked on. I believe we should have evidence-based medicine. I think it makes a lot of sense. I would encourage it. And I think that's what we're trying to get at in the plan. So I think that's important, but rationing does exist right now in our current system. And we will continue to have procedures based upon evidence that are reimbursable. I mean, that's what will happen.
Dr. Store,
Dr. Ed? Dr. Ed, you want to ask your question?
I have a unique opportunity to actually poll bunches of people every single day about their health insurance. And a number of things come clear when you talk to people. One of the statements that's always made is that people are happy with the health insurance they have. And they're happy when they have their heart attack and need $15,000 worth of cardiac surgery. But they're not happy when they have to pay for their drugs or they get priced out of their drugs. Will the current bills allow patients two things? One, to have standardized plans so things are understandable, so they know what's in the plan and what's covered. And two, will it restrict the ability to deny the use of medications based on a 4-tier reimbursement system?
Yes, there would be a standardization. And that's part of the idea of the exchange, is not just to have the public option, but to be able to compare apples to apples. A lot of challenges exist right now if you go out in the private market and try to compare plans as to what's covered and what's not covered. It's not always clear. Now, the idea behind the exchange and the 3 tiers is that it would be very clear what basic procedures are covered, what basic care is given. In terms of the pharmaceutical coverage, one of the most important things that the House plan does, and you didn't ask this, but I think it's important when it comes to pharmaceuticals, is closing the donut hole. I don't know how many of you are seniors. If you're on Medicare right now, would you raise your hand? For those of you on Medicare, if I could briefly describe what the donut hole is. The donut hole, right now, Medicare covers, Medicare Part D covers pharmaceuticals until you reach a threshold. At that point, usually somewhere halfway through the year, you're on your own in terms of payments until you hit a catastrophic level, at which time Medicare picks it up again. This closes it, and the negotiations that you may have heard about between the White House and the pharmaceutical industry are all about that. So that does it. As to the specific question about the 4 tiers, I'm not certain, and I can look into that for you, and I'd be happy to talk to you more about it. But it's my understanding that there would be standard procedures when it comes to pharmaceuticals, and that would be crystal clear in each of the plans.
For those of you who aren't familiar with the 4-tier system, most drug plans will cover the largest percentage of generics, and then dispensed as written, and then a tier above that, a name brand drug, and finally drugs that are outside what is called the formulary. If you're not on the formulary and you need that drug for your disease or illness, too bad. You're not getting covered by your prescription drug plan at all. That's the 4 tiers of the prescription drugs.
That's untrue, sir. That's true. That's untrue. That's a lie.
One of the ideas of disrupting a meeting is that other people yell back. If you yell back, you got a disruption. So let's not yell back. And if the gentleman or others keep talking, they will be escorted out.